If you're over 60 and you've noticed yourself feeling just a little less steady on your feet, a little more careful on stairs, or catching yourself wobble when you stand up too fast, I need you to pay close attention to what I'm about to share because balance problems are rarely just getting older. My name is Dr. William Lee, and in my years of practicing medicine, falls are one of the most common reasons I see otherwise healthy seniors lose their independence almost overnight. Today I'm going to explain exactly why balance declines with age, what's actually happening inside your body when it does, and the specific simple changes that can reverse it, often faster than you'd expect. Stay with me until the end, because the third cause on this list is the one almost nobody checks for, and it's often the easiest one to fix. And I'll also share the story of a patient whose fall risk dropped dramatically once we identified exactly what was going wrong, along with a second story later on that shows just how quickly things can turn around once you know where to look. Let's start with the basic problem. Falls are the leading cause of injury-related hospital visits among adults over 65, and the risk increases significantly with each passing decade. But here's what most people don't realize. A fall itself isn't really the root problem. It's usually the final symptom of something that's been quietly declining for months or even years beforehand. Balance isn't one single system in your body. It's actually a coordination of three separate systems working together: your inner ear, your vision, and the sensory feedback coming from your muscles and joints, particularly in your feet and ankles. When even one of these three systems starts to weaken, your brain has to work harder to compensate using the other two. And when more than one starts to decline at once, that's when real instability sets in. What makes this especially deceptive is that your brain is remarkably good at compensating right up until it isn't. Many of my patients tell me they felt completely fine, right up until the day they suddenly weren't, and that's exactly the pattern this kind of gradual, compounding decline tends to follow. The first major cause is one you've probably never thought about: the inner ear. Deep inside your ear sits a structure called the vestibular system, tiny fluid-filled canals that detect motion and send signals to your brain about your body's position in space. As we age, the cells lining these canals naturally begin to degrade, a process researchers have documented extensively in studies on age-related vestibular decline. This is part of why so many seniors report a specific kind of dizziness when they turn their head quickly, or feel unsteady getting out of bed in the morning. It's not anxiety, and it's not just aging. It's a measurable physical change happening in a part of your body most people never even knew existed until it starts causing problems. What's particularly interesting is that this system doesn't just tell you which way is up, it also helps stabilize your gaze while you're moving, which is why some people notice their vision seems to bounce slightly while walking once vestibular function starts to decline. There's also a specific, common form of inner ear dysfunction worth knowing about called benign paroxysmal positional vertigo, often shortened to BPPV. This happens when tiny calcium crystals inside the inner ear become dislodged and drift into the wrong canal, sending false motion signals to your brain whenever you tilt your head a certain way, like rolling over in bed or looking up at a high shelf. It's surprisingly common in older adults, and the good news is that it's often correctable in a single office visit through a specific series of guided head movements performed by a trained provider. I mention this because so many seniors live with this treatable condition for years, quietly avoiding certain movements or sleeping positions, without ever realizing there's a quick, well-established fix. The second cause is one that develops so gradually, most people don't notice it until it's significant. Vision changes. As we age, our eyes lose some ability to detect contrast, meaning the edge of a step, a curb, or a slightly darker rug can become harder to perceive, even if your basic eyesight test looks fine. Depth perception also naturally declines, which affects how accurately you judge distances, especially on stairs or uneven ground. What's tricky here is that many seniors pass a standard eye exam with flying colors, because that test measures sharpness, not contrast sensitivity or depth perception, the two things that matter most for balance and fall prevention. I've had patients with technically excellent vision on paper who were still at meaningfully elevated fall risk simply because nobody had ever tested the specific visual skills that matter most for navigating stairs, curbs, and dimly lit rooms. It's also worth mentioning bifocals and progressive lenses here, since I see this trip up patients more often than you'd expect. These lenses are wonderful for reading and close-up tasks, but the lower portion of the lens can distort depth perception when you're looking down at stairs or uneven pavement, right when accurate depth perception matters most. Some of my patients have found it genuinely helpful to keep a separate pair of single vision glasses for walking outdoors or navigating unfamiliar stairways, simply to remove that added layer of visual distortion during the moments it matters most. Now, here's the third cause, the one I promised you, the one that gets missed constantly: peripheral neuropathy, particularly in the feet. This is a gradual loss of sensation, often linked to diabetes, certain medications, or simply age-related nerve changes, and it means your feet aren't sending your brain the detailed feedback it needs about the ground beneath you. Your feet are essentially covered in thousands of tiny sensors that tell your brain in real time whether you're on a flat surface, an incline, or something uneven. When that feedback weakens, your brain is essentially flying partially blind, relying almost entirely on vision and inner ear input to stay upright. Many seniors don't even realize this is happening because the sensation loss is so gradual, but it's often detectable with a simple test your doctor can do in under a minute, and I'll explain exactly what to ask for in just a moment. One subtle sign worth watching for is difficulty telling the difference between socks of slightly different thickness just by feel, or not noticing a pebble in your shoe the way you once would have. Let's also talk about something that compounds all three of these: muscle weakness, particularly in the legs, hips, and core. Starting around age 30, we naturally begin losing a small percentage of muscle mass every decade, a process called sarcopenia, and it accelerates significantly after 60 if strength training isn't part of your routine. Weak hip and ankle muscles specifically make it much harder to make those small, rapid corrections your body needs to make dozens of times a day just to stay upright. The kind of tiny adjustments you never even consciously notice happening. When those muscles weaken, a simple stumble that your body could have easily corrected for at 50 becomes a full fall at 75. This is part of why two people can trip over the exact same uneven sidewalk crack, and one simply catches themselves and keeps walking, while the other ends up in the emergency room. The difference often isn't luck, it's the strength and speed of that automatic corrective response. And then there's medication, a factor I see overlooked constantly. Certain classes of medications, including some blood pressure drugs, sedatives, and even some antihistamines, can affect blood pressure regulation, reaction time, or inner ear function. Studies on polypharmacy and fall risk have found that seniors taking multiple medications from these categories face significantly elevated fall risk, not because any single medication is dangerous on its own, but because of how they interact together and how the aging body processes them differently than it did decades earlier. This is especially relevant for over-the-counter sleep aids and allergy medications, since many people don't think of these as real medications worth mentioning to their doctor, even though they can meaningfully affect balance and alertness. There's one more contributing factor I want to mention before we move to solutions, because it ties everything together in a way that's easy to overlook: sleep quality. Poor or fragmented sleep doesn't just affect memory, it also measurably slows reaction time and impairs the coordination between your vision, inner ear, and muscles that balance depends on. Seniors who sleep poorly often show slower correction times when they stumble, simply because a tired brain processes and responds to sensory information more slowly. This is part of why falls tend to cluster in early morning hours, when sleep inertia is highest and the body hasn't fully woken up its balance systems yet, even though the person feels alert enough to get up and start their day. Home environment matters more than most people give it credit for as well. Poor lighting, loose rugs, cluttered walkways, and even the height of a favorite chair can all meaningfully increase fall risk on top of the physiological factors we've already discussed. I always encourage patients to walk through their own home the way an outside observer would, checking hallways for adequate lighting, securing or removing loose rugs, adding grab bars near the tub and toilet, and making sure frequently used items aren't stored somewhere that requires reaching or climbing. These changes cost very little and take an afternoon, but they remove entire categories of risk that no amount of physical therapy can fully offset. So now let's talk about what actually works, because the encouraging news is that balance, unlike some other aspects of aging, responds remarkably well to targeted intervention, often within just a few weeks. The first and most important step is simple: get a formal balance assessment. This isn't the same as a general physical. Ask your doctor specifically for vestibular testing, a contrast sensitivity vision check, and a peripheral neuropathy screening in your feet. These three tests together will tell you exactly which of your three balance systems needs the most attention, rather than guessing. Too often, seniors are told simply to be careful after a near fall, without ever getting the specific testing that would reveal what's actually driving the problem. For the inner ear specifically, there's encouraging research on something called vestibular rehabilitation therapy, a set of targeted head and eye movement exercises that can actually retrain your brain to compensate for age-related vestibular decline. This isn't something you need to figure out alone. Physical therapists who specialize in balance can build a short, simple routine you do at home in just a few minutes a day, and many patients notice meaningful improvement within 4 to 6 weeks. What's remarkable about this therapy is that it doesn't necessarily repair the inner ear cells themselves. It trains your brain to rely more heavily on your other two balance systems to compensate, essentially rewiring the way your brain processes balance information. And if BPPV is the culprit, ask specifically about repositioning maneuvers, since this particular issue often resolves in a single well-executed session rather than requiring weeks of therapy. For vision, make sure your eye doctor is specifically testing contrast sensitivity, not just visual sharpness, especially if you've had any near misses on stairs or uneven ground. Simple changes like improving lighting at home, adding contrasting tape to the edges of steps, and removing loose rugs can dramatically reduce your risk while any underlying vision issues are addressed. Even something as small as switching to a brighter, warmer bulb in your stairwell or hallway can make a measurable difference in how clearly you perceive edges and depth. If you wear progressive or bifocal lenses, talk to your eye doctor about whether a separate pair of distance-only glasses might serve you better for walking and outdoor activities. For the nerve sensation in your feet, daily foot and ankle exercises, things as simple as picking up small objects with your toes or standing on one foot while holding onto a counter for support have been shown to meaningfully improve balance-related feedback over time. If neuropathy is significant, your doctor may also recommend specific footwear designed to enhance sensory feedback, which can make a noticeable difference almost immediately. Going barefoot or in thin-soled shoes at home, when it's safe to do so, can also help, since thick cushioned soles can further dull the sensory feedback your feet are already struggling to detect. If diabetes is a factor in your neuropathy, keeping blood sugar as stable as possible is one of the most protective things you can do for your long-term balance, since nerve damage from fluctuating glucose levels tends to worsen over time if left unmanaged. And for muscle strength, this is where consistency matters more than intensity, just like we've discussed before. Simple exercises like standing up from a chair without using your hands, walking heel to toe along a hallway, or gentle single leg standing near a sturdy counter can significantly improve the strength and coordination needed to prevent falls. Studies on structured balance and strength programs for older adults have shown fall risk reductions of well over 30% in participants who practiced consistently, and most of these programs require only 10 to 15 minutes a day. What I find most encouraging about this research is how quickly the body responds. Unlike some age-related changes that take years to meaningfully shift, balance-specific strength training often produces noticeable improvement within the first month. Finally, schedule that medication review we've talked about before. Bring your full list to your doctor or pharmacist and ask specifically whether any of your current prescriptions could be contributing to dizziness, slower reaction time, or balance issues. Sometimes a simple adjustment in timing or dosage, without eliminating a medication you need, can meaningfully reduce your fall risk. This is also a good opportunity to mention any supplements or over-the-counter products you're taking regularly, since these are often left out of medication reviews entirely, even though they can still interact meaningfully with prescribed drugs. Let me tell you about a patient who really illustrates how this all comes together. She was 78, active, sharp, and had experienced 2 near falls in her kitchen within the same month, both times catching herself on the counter just in time. She'd assumed it was simply age catching up with her. When we ran the full assessment, we found mild vestibular decline, early contrast sensitivity loss in her vision, and noticeably reduced sensation in both feet, likely related to long-standing, well-managed diabetes. No single one of these would have caused a fall on its own, but together they were quietly working against her. Over the following 2 months, she started vestibular rehabilitation exercises twice daily, switched to shoes with better sensory feedback, added contrasting strips to her stair edges, and began a simple twice-weekly balance and strength routine with a physical therapist. At her follow-up, not only had her formal balance testing scores improved significantly, she told me she felt more confident walking her dog around the block than she had in over a year. Her case is a perfect example of why identifying the specific cause matters so much more than simply being told to be more careful. I also think of a gentleman I treated who came in after a single frightening fall in his bathroom at 72, previously in excellent health with no chronic conditions at all. His assessment revealed nothing more than mild BPPV, that inner ear crystal issue I mentioned earlier, likely made worse by a habit of quickly looking up at a high shelf every morning to grab his medication. A single repositioning maneuver in our office resolved his vertigo almost completely, and combined with simply moving that shelf to eye level, he never had another episode. Not every case requires months of therapy. Sometimes identifying the precise cause turns what feels like a frightening, mysterious decline into a 15-minute fix. I want to leave you with this. Balance decline is not something you simply have to accept as an inevitable part of getting older. It's a measurable, treatable set of changes across a few specific systems in your body, and every single one of them responds to targeted attention. The seniors I've seen make the most remarkable turnarounds are rarely the ones doing something extreme. They're the ones who identified exactly which system needed help and worked on it consistently for a few weeks. Balance, more than almost any other aspect of healthy aging I work with, tends to reward consistency with genuinely fast, noticeable results. And the earlier you address it, the more of your natural strength and coordination you preserve, which is exactly why I'd rather you act on a small wobble today than wait for a serious fall to force the issue later. If this video helped you understand something new about your own balance, or about a parent or loved one you're concerned for, tell me in the comments which of these causes surprised you most. I read through them, and I want to know what resonated. And if you know someone who's had a recent stumble or near fall they brushed off as nothing, share this with them today, because catching this early makes all the difference. Subscribe for more real, evidence-based guidance like this, and I'll see you in the next one.